Good afternoon, everybody. Welcome to this webinar from CHF about telehealth. Thank you all for making the time, and thank you to people who've sent in questions already. I'm Jo Root. I'm the Policy Director here at CHF. We've got 5 panelists who I'll introduce in a moment to you. Sorry, 4. Whoops, I can't count. That was a good start. 4 panelists and myself and Anthony, who is, some of you have contacted, who is sort of keeping me on track. Before we go any further, I'd like to acknowledge that we're all meeting on Aboriginal and Torres Strait Islander land. I'm in Canberra, so I'm meeting on the land of the Ngunnawal people. I'd like to pay my respects to the traditional owners of this land and to the elders, both past, present and emerging. I'd also like to acknowledge that this sovereignty of this land has never been ceded, and this was and always will be Aboriginal land, and you are all on the lands of various people. So thank you. The panelists today are Karen Finnin, who is a physiotherapist and digital health consultant, Ros Knight, who's a clinical psychologist and currently president of the Australian Psychological Society, Chris Campbell, who is the General Manager of Policy and Engagement at the Pharmaceutical Society of Australia, and I think is fairly new to that role, if I'm not mistaken. And Dr Amandeep Hansra, who is a General Practitioner and Digital Health Consultant. So how we're going to do it today is that each of the 4 panelists is going to give you a few opening comments with an emphasis on what they see as the greatest opportunity that telehealth is giving to them, and perhaps the challenges in doing it. And then we'll go to an open discussion. We'll do some of the questions that you've already sent in to us. If you have any additional questions that you'd like to ask, you can put them in at the bottom of your screen. You can see a Q&A function. If you type in your question there, Anthony will be having a look at the questions, and we will try to bring some of the questions that come out of what people say. So I think you can't use the chat function, but you can use the Q&A. So if you've got any comments, anything you want to put in that you want to communicate to us, put it into the Q&A and we can have a look. Be aware that everybody can see the Q&A, so just moderate your comments accordingly. Okay, we hadn't decided who would go first, but I'll just arbitrarily decide. Karen, do you want to talk to us about? Do you want to tell us a bit about yourself and talk to us about what you see as the challenges and opportunities of telehealth for physiotherapy?
Yeah, absolutely, Jo. Thanks so much for the opportunity. So yes, my name is Karen Finnin. I'm a musculoskeletal physiotherapist and the director of Online.physio. So we're an entirely online physiotherapy practice, and I've been involved in telehealth and giving telehealth consultations for the last 9 or so years. And, of course, it's a very awful situation that's brought us here, but as we're all learning, with adversity comes opportunity. And so, a lot of the things that we're seeing in telehealth at the moment, have a little combination of both. I think the first wave of challenge that we as a profession, as physiotherapists, faced was as we looked at closing our doors of bricks and mortar practices and transitioning to the online space, how was the best way to, educate our health consumers that what can be thought of as a traditionally very hands-on profession can actually be very effective online. We need to learn that it's not as simple as just offering a telehealth consultation if there isn't the insight into what can be done online and how effective it can in fact be, and what people and conditions lend themselves really well to the online space. So I think that's something that we've upskilled in very quickly, but will continue to be a work in progress to continue that sort of health consumer education piece, I guess, around health professions that perhaps aren't intuitively thought of as suitable for telehealth. I think the next big opportunity that we've had has been in obtaining, in allied health professions, is obtaining rebates through private health insurers, through the compensable bodies. This has been a long, long time coming, and it's obviously happened all of a sudden, which is fantastic to see. But again, the challenge it presents is that us as health professionals have to make sure we do a great job of this so that we can retain that funding beyond this period of time. And I guess that leads on to the third challenge and opportunity that we've seen, is that how do we measure our success? How do we measure the sticking points through this time so that we have that information to present to health consumers, to present to funding bodies, and to convince ourselves, obviously, that telehealth is being effective. And I'm really pleased to say that some great telehealth researchers at the University of Queensland, University of Melbourne, Flinders Uni, along with the Australian Physiotherapy Association, have rapidly obtained funding and ethics approval to look at a cohort study to start to record and measure some of these opinions, attitudes, and outcomes over this time. So yes, double-edged swords, but we're making the most of it. So it's been obviously a really interesting time.
Thanks very much, Karen. I think you've raised some really interesting points there that we might talk about a bit later. I might go to Ros next from a psychologist point of view and from the society's point of view. What have you seen as the challenges and the opportunities, Ros?
Thanks, Jo. As a clinical psychologist, I have to say the opportunities in this are fantastic, really. I think we've been asking for this for general members of the public for a long time. So telehealth has existed for rural, regional and remote for quite a long time, but clearly that's had very limited uptake for a range of reasons that we don't need to go into here. But we've always argued that for some members of the public, telehealth would always be a better option than trying to get them to come face to face. So having this opportunity, I think, has been really, really good overall. Now, of course, at the moment, it's under that horror of COVID and COVID needs where people have been isolated. So it has a particular focus in the government's mind, and therefore telehealth only exists for us until the end of September. And like Karen said, we would be arguing that it probably, A, I don't think COVID's going to be done by the end of September, but B, I think we would want to see government continuing to extend that. But we already have quite a lot of research showing telehealth works for psychological services for most problems, but not all. So I think the challenges for us have been, as Karen said, upskilling all of those of us who haven't used telehealth regularly all the time until now, making sure we're using the right platforms, and the APS did some research into which platforms were good for what. Also working out the telehealth item numbers, how we could use them, how we bill for them. For a while there, they were limited to bulk billing items, but that's now been relaxed, which is very helpful for practices who want to stay afloat. But there's still a group of clients where it doesn't work. And clearly the main challenge is internet around Australia. Very variable, isn't it? Like I live in Sydney, even in the middle of Sydney, there's suburbs where internet is really poor. So that limits what we can do. And phone is by no means as good as audiovisual like we have now with Zoom. So that's the biggest problem. But equally, there are problems with particular disorders like psychosis and trauma and dissociation, where telehealth just doesn't provide the necessary containment and backup. So I think it's not a cure-all and it's not an answer to everything, but it's been an absolute godsend at this time with the problems we've got with COVID.
Thanks, Ros. Really good. And Chris, from a pharmacy point of view, some people probably aren't aware that pharmacists actually can access telehealth, so you might want to enlighten us a bit.
Yeah, thank you so much, Jo. And you probably covered off one of the main challenges that we have had in terms of pharmacy was a little bit of a delay for the telehealth consultations to be enacted. Thankfully, they have. What we have seen, particularly in primary care, so in the community, is that chronic conditions don't go away. So just because COVID has come and the advice to stay at home, we have been needing to reach out to our regular patients who we know quite well, who may be fearful of coming in. So one of the things that has been opened up with the access of telehealth consultations is our pharmacists are now reaching people who have been too scared to leave their home. Quite frightening is that they didn't realise that they could consult their GP by telehealth. So it's a proactive connection that we're having with our most high risk patients and high need patients, and then connecting them in with the other care that they can access via telehealth, be it psychology, be it physio, be it a general practitioner. So that's one of the great things that have happened. The interesting thing that we have found on the back of telehealth consults being enabled is how to get a physical prescription to a pharmacy. And one of the most interesting things about this is, and this will frighten a majority of people who are watching, the main way prescriptions from a telehealth consult received in the pharmacy is by a fax. It is outrageous. In fact, some of our pharmacies, 80% of their prescriptions now are received by fax, with a mixture of delivering the medication to the patient's home, or they're coming in to collect that from the pharmacy. The interesting side from pharmacy perspective is, yes, we have the clinical work that we do in terms of ensuring medication safety and connection around medication adherence. But medications won't work unless they actually arrive to the person's home. And so there's been a multitude of flow-on effects and adjustments to how the majority of pharmacies look after their patients. So what I will say, and particularly the point that Ros made in terms of remote and rural access to care, we have pharmacies that are in very remote areas that have been providing medication care. An example is one of my colleagues who works on Thursday Island. The only way they can access the islands is twice a year by plane. What telehealth has enabled her to do is to be able to provide that medication safety, the medication review services via telehealth. And I probably echo what every other panelist say. We see so much benefit of continuing this on after COVID.
I'm getting a view that people don't want this all to stop in September. The last presenter is Dr Amandeep Hansra, who is a GP and digital health, and I deliberately left the doctor till last. But would you like to tell us what you think are the challenges and opportunities?
Thanks, Jo, and it's really a pleasure to be here today. I've felt like all my Christmases have come at once with all this telehealth stuff. Unfortunately, in a situation that none of us really would have wished for during this COVID-19 pandemic, but it is certainly a time to be taking advantage of some of the opportunities. So I've been working in telehealth for the last 10 years, but I also work as a GP in Bondi in Sydney, one of the hotspots for COVID. So telehealth has certainly come into use here at our practice very quickly. But I think what I kind of want to make the point about telehealth is that everybody sees it as something quite new, and it's a little bit daunting and threatening. But the reality is telehealth has been around in Australia at least since the 1920s. So the RFDS were one of the first organisations to provide medical care through two-way radios that were actually power generated by pedals. And these guys have been providing remote medical care for longer than any of us had even heard of the word telehealth. And really what we're doing is we're putting a term to something that's already been occurring. But why it's suddenly of interest now is because we're using telehealth, which is basically provision of remote care using technology in a way that we haven't before in everyday practice for people, whether they're in urban areas, in rural areas, whether they're in aged care facilities, whether they're in Aboriginal medical centres, because we've been faced with a challenge that is threatening, I guess, risk of infection, both to our patients, but also to the clinicians providing the care. So we've really finally got a driver to say, well, telehealth is actually appropriate for everybody, not just people in rural remote areas, not just, in the after hours period, or not just in, particular regions or particular populations, but for everyone. And so while we're faced with this sort of common challenge, it's given us an opportunity to look at how do we rapidly change how we deliver care, and that's across the board for general practice, specialist care, allied health, mental health. I mean, it's been amazing to see the uptake across the whole of the healthcare industry, but I think it's really also given us the driver to fund it, and I think the funding is what's really critical for this to be able to continue, because it's hard for clinicians to provide care if there's not a funding mechanism for it. And that has been the resistance from a lot of my colleagues for the last 10 years. And what I've been trying to lobby hard and advocate for is that this does need to be funded. And so luckily for us, during COVID, we managed to get some Medicare item numbers, which has allowed GPs to embrace telehealth and to embrace it in a way that allows them to continue to provide really good quality care to their patients, but doesn't risk their patients getting COVID or being amongst other unwell patients. And I think that's where we are now catching up to where we should have been. And now the question is, as Joe was saying, how do we continue this post September the 30th when these item numbers stop? And I think this is where both consumers, patients, and clinicians need to say, this is actually something that needs to stay in place, not just during pandemics, not just during bushfires. And for those of you that don't know, we did have some temporary item numbers for the bushfires. So it's starting to show us that actually telehealth is great for lots of different situations, natural disasters, pandemics, but also just to vulnerable patients who shouldn't be mixing with other patients, or patients who are having trouble accessing care because they're stuck at home or in their rural remote regions, or for any other reason, mobility issues. So there's so many applications, and I'm so excited to see this finally get the uptake that it deserved, and I would really love to see it continue, because I think it's really going to change the whole of how we deliver primary care.
Thanks very much, and thank you to all the panelists, and the questions are coming in thick and fast, I have to tell you. Some of them are aligned. I mean, one of the questions that came up beforehand and has come up a couple of times here is, what extra preparation do people need to do if they know they're going to have a telehealth? And it was directed to you, Karen, initially, but I think it also is valid for others. So do you want to lead off with, Karen, about how people need to prepare for online as opposed to a physical physio appointment?
Yeah, absolutely. This is a really great question. And look, the advice that we give our patients is, first of all, use what you've got. You don't need expensive or new equipment for it. So whatever gadget you have, we can access you on. Now, the bigger the screen, the better you'll see us. So if you have a choice between a phone, tablet, and a laptop, perhaps start with the laptop. It stands up on its own, but is also mobile. Probably the desktop might be a bit restricted if you're having a health consultation where you may need to move around a little bit. The next step would be secure that gadget so that it stands up on its own and that you don't have to hand hold it. And also, if you can, see if the camera can be at eye level, because that's a really lovely way to chat back and forth. Now, have a think about where your window is. It's great if natural light is falling on your face. We can see your beautiful faces better. In terms of audio, a quiet space is important if you can find it. And plug-in headphones generally give a better quality audio. Now, if you are somebody who has a Bluetooth headset, I would recommend that for physiotherapy consultations in case we do need you to stand up and move around. You're not then tethered with a cord. Having said all of that, if you simply use the audio of your gadget, we can make that work as well. Now, from a physical perspective, we would say if you have an upper limb, upper body condition, make sure you have a singlet on, perhaps a jacket over the top that's easy to take off so you don't get too cold. And if it's a lower limb problem, perhaps wear a pair of shorts. You can pop a rug over your knees to start with as well. So they're just a few really quick tips to make the environment suitable to get started. And I'm sure some of the others will have some other tips more relative to their health professions as well.
Yeah, I wonder if there's any of the others want to comment about whether people need to gather some information, more information to have ready on hand to talk to their clinician about. I mean, Ros, did you have? Do people need to prepare differently for an online psychology?
It is a little bit different. I'm listening to Karen's guide and going, yes, the same. Oh, actually, no, probably don't need the singlet. but you know, it's, but yes, having a stable platform. I think the additional two things we would say for psychology is absolutely the visual and the audio needs to be as good as we can get. Now, back to my earlier comment about internet really does vary, we get that. And we'd still prefer to try an audio visual over phone in pretty much all instances if possible. Probably the additional one is around confidentiality. So for us, it's absolutely crucial if you can find a space in your residence or wherever you are that others cannot overhear what is going on. And that makes it trickier if it's a family consult, you know, is the child in the room, out of the room, where are the parents? So some of the preparation is just around where you position yourself in the house to feel safe so that you can talk about what you need to talk about and not think somebody's listening next door. And that may require a headset. So instead of just talking to camera as we are now, if you're concerned you might be overheard or somebody will hear what we're saying, then we would suggest use of a headset would be the big difference. Additionally, there's preparation behind the scenes. Now, this may not be different to physio, I suspect, at the end of the day, where we would send a lot of online questionnaires these days or ask for reports to be forwarded, password protected across email, whereas normally you just bring those in and we just get you to do the questionnaire on the spot. So there's a little bit more work behind the scenes, just making sure you feel safe and secure and you can see, and that you've got a few things signed up beforehand.
Chris or Amanda, do you want to add anything on this one? Do patients need to prepare themselves differently, or do clinicians need to prepare themselves differently?
I'll quickly answer that because I'm sure there's more to add in terms of observations, etc. The best part we're finding is when people, obviously we focus on medicines, that they bring them and have them ready. One of the early feedbacks was holding up a medication to the camera to ensure the clarity around what actual medication is being discussed. We find just over the phone there can be some things lost in translation. That also is really helpful when we have someone whose English might be their second language. The other thing, and I'll you know, to Ros's point on confidentiality, we do like to start the consultation with a statement around, you know, this will not be recorded. This is we ask the same of the person that's we're conducting the telehealth consult. That confidentiality is so very important, and you know, I echo the advice around if they are uncomfortable about it, making sure they're wearing headphones and knowing that to be cognizant of who's around them. It's you know, just as important in a telehealth consult as it is within all of our practices.
Dr. Hansra, did you have anything you wanted to add?
Yeah, I just want to emphasize, I guess, Ros's point around confidentiality, especially during COVID, because we've got a lot of families who are living on top of each other. You might have young children in the room next door. You've got, you know, potentially your partner. You've got, you know, extended family, and even if you're in a room and you've got the door shut, you know, I've had patients who've been anxious about, you know, who's outside the door and not being able to disclose everything. I've even done consults with patients sitting in their car that's parked in the front of their house, as long as they can still get internet connection. Just having that closed in space, because you kind of forget how comfortable people feel in the confines of a consulting room where they feel like there's no one else from the family around that could potentially hear them. We have had cases of domestic violence that we've had to assess, you know, outside the house because, and they can't go anywhere else. So we put them in their cars, which is not ideal, but, you know, if they can get a phone connection or an internet connection. So really important to make sure, and I always do that at the beginning of every consult, is I just say, are you comfortable? Is there anyone else around? You know, or sometimes you do need another person around. And this is particularly in the case of, as Chris said, where there's, you know, a language issue, or sometimes when we're examining people, we might ask for an assistant. So we'll say, can you go and get, you know, your partner to help you do this particular move on the video so we can kind of examine you. The other thing I always tell parents is that when you come to a consult with a child, you always bring the child. I find with telehealth consults, some of the parents don't have the children with them, and they'll do a consult with me and they'll say, but my kid's not here, with their other parent, or, you know, they've actually gone to school if they're an essential worker. We still need the patient to be part of the telehealth consult. So it's really important that parents or carers bring the patient with them or have them in the room or easily access them. The other thing that for a GP consult I recommend to patients is if you have a thermometer or you have a blood pressure machine or any tools that you have, again, like Karen said, don't go out and buy anything for telehealth. We will make do. But if you have those things handy, it's great. I can just say, take your temperature and show me the reading. And as Chris said, brilliant way to check people's medications because they never bring them into the practice. But if they're at home, it's a great time to say, go and open your kitchen cupboard and let's have a look at what you've got in there and what you're actually taking, as opposed to what's on my record in my patient management system, which is hardly ever correct, unfortunately, until we do that reconciliation. So it's great opportunity to actually have a look at the environment, but just say bring everything with you, and it's really important to bring the patient with you. As silly as that sounds, make sure the patient's in the room.
Following on from that, and it's something that a couple of you have raised, somebody did raise a question with us about, you know, you're getting a unique window into the personal lives of consumers in their homes, and you may see something, or for example, evidence of domestic violence that you wouldn't see when somebody comes and sees you in your pharmacy, in your practice, generally. Are there do the mandatory reporting requirements, would they kick in if you saw something like that and you had suspicions? Is that something that has come up for you as a group of clinicians, that you see something about somebody's life that you weren't aware of before that you think needs attention?
I'm happy to start that by saying yes, that is happening more, as Deep just said. We don't have to mandatory report domestic violence, and that as psychologists, but we would have to report to docs if there were children involved. So we are seeing more of that than we used to see, and are definitely having to grapple with more risk issues like suicide risk and homicide risk than we would otherwise. On a different level also, it does help diagnostically. If I put a bit of a, I suppose, a positive side to it, which is we can also see hoarding and other problems that we wouldn't necessarily see if we weren't looking into the house. So the same rules apply in terms of having to mandatory report as that we currently have face-to-face. But yes, we're seeing more evidence of some of this now. Yeah.
Anybody else want to comment on that one? Anybody else come up as an issue?
So absolutely, and we have had, exactly as Ros said, insights into people's domestic situations, which we didn't have before. But basically, any information that we have as healthcare providers, it doesn't really matter how it's presented to you, whether somebody reports it or whether you see it, we do have an obligation to act on that. But on another point, as Ros was mentioning, we actually do get extra information, extra insight. And for me, it's been around some of the functional impacts of people's conditions. So being able to see how they've set up their home, because you never realize that they had trouble mobilizing, but you're seeing they've put all these things in place to try and get from A to B in the home, which you and Karen might have seen this as well. But I think for occupational therapists and other allied healthcare workers, being able to see into that home and seeing how someone's actually living gives us so much more information than what they just choose to report things to you. And you might see, you know, bottles of alcohol that are being consumed in the middle of the day, or you might see that, you know, they've got, you know, just the way they're living means that they're not coping. So I think there's opportunities there, definitely, and some of it, you know, a bit saddening to see, but we can then act on that.
Yeah, I mean, a question that's come up in several places here is whether it's which is better, a telephone or a visual. I note the AMA in I think in their promotional stuff about telehealth have a picture of an old-fashioned telephone and say a phone's fine. Is there a difference, and which should people be opting for, and who should be making the decision whether it's audio only, like telephone only, or using an app to actually see people?
I might start, and then I know that the different health professions will have different views on that as well. I think that the short answer for us is the more information we can gather about someone, the better. So if we have an availability to access them visually, as well as, you know, through other means of collecting information, absolutely. But we need to look at what we're comparing it to. If a phone-based care is something we can access where the opportunity would otherwise be nothing at all, well, clearly qualified care, you know, is going to be still better with the clinical reasoning that we have, with the knowledge that we have, you know, that is going to be preferable. But I certainly think that we need to get past the barrier of people thinking that the video consultation is too much hassle and that we just revert to what we know. I think we've got the opportunity to push out of our comfort zone a little bit now and find that actually it's not that scary. You know, if health professionals select great video platforms, they should be very easy to use. And often after just one consultation, it really shifts that mindset. So use the best that you've got, but anything is better than nothing would be my message. As long as we're always keeping the patient safe, of course.
And as we can hear, we've got the usual Zoom interruption of someone's dog. I've got 4 dogs, it's all right, mine always interrupt. Anybody else want to comment on which is better, or which mechanism should be used?
I'll just add that as psychologists, we're more dependent on non-verbal feedback. Well, no, actually, I would have thought physio needed visual feedback too. But so I think we therefore do advocate for use of audio-visual over phone as a strong preference. If I add it to it a different way, it's also about risk as well as understanding. So clearly on the phone, as we all know, you get a certain level of information about how somebody's really feeling, but you're only getting some of that. So understanding can be compromised a bit, but also risk. You know, it's much easier audio-visually to see the risk involved if somebody's very distressed and agitated than necessarily by phone. Clearly, probably what I should have said earlier is managing risk is still really important. So what you'll find is different, at least for psychologists, is at the beginning of every session, they'll check where you are, what your phone number is, where you are, and who at least one, if not 2 contact people are, where, you know, that they can contact, so that if you become very distressed, get cut off, we can't reconnect with you, there will be an immediate follow-up. And that may be a bit different too. So face-to-face, we usually feel we can manage that much more carefully, whereas using telehealth with risk, we will call the police faster than we might have done, or an ambulance, although ambulance costs, so we're mindful not to call ambulances, than we might have done face-to-face. So that's probably another difference, that we have to try and manage that. So audio-visual gives us much more information that helps us to manage that calmly. But agree with exactly what Karen said. You know, if phone's what you got, phone's what we'll use. And there is still research evidence that that's useful.
Chris or Dr. Hansra, any comments on that?
Look, we always find the information gathering so much better if you have a visual. I have nightmares around thinking I've understood over a telephone around certain medications and what's needed, and when I physically saw the patient, and lucky enough to see the reality doing home medication reviews of what that reality is. It's why it's been such a successful service in terms of safety. It's an improvement. One thing that I will say, and why I have been really excited about the opportunity, is it's knowing as a clinician where your barriers are yourself, and so it might be you might notice something, but because they're already on telehealth, it's quite easy to email links to other providers. Whereas in the past, we would have verbally given a referral or said, look, you really need to see your GP about this, or see a psychologist. But now I can email a link and go straight to that. And I know that they're comfortable with the platform. From a pharmacist perspective, connecting into other health providers and knowing that they're followed through, or at least increasing the chance of that follow through, is something that an unintended benefit of being able to have that. Knowing your limitations and then helping them connect in. Ros's point about making sure someone is around them that if they need to, from a safety perspective.
Yeah, so I might just add that most of the GP consultations that have been done over the last 2 months have actually been on the phone. So the stats, we've done over 5 million telehealth consultations over the last 2 months, and around 80% of those have been on the phone. That's not to say that we shouldn't be encouraging video. I think it's just, again, where we're saying to consumers, use what you have. We've had to say the same to healthcare providers because this thing has been so rapid in its onset. So GPs have been grappling and just grabbing what they have. When everyone has a phone, they don't all have video platforms. So I think just because the GPs have been offering phone doesn't mean that that's, definitely, the way to go moving forward. I think there's always going to be a mix. So I find that having a phone call with a patient where I'm just telling them their blood test results, and I know that patient really well, it is perfectly adequate. But if it's a patient, especially if there's a child or something and they say, my kid looks a bit sick, I'd really love to have a visual of that child, because really just that quick eyeballing of going, okay, this is a really sick child, or this is one that we're probably going to be able to manage at home. It's hard to do that over the phone. So I would encourage, video if possible, but there are certain things that the GP certainly will say is easily done on the phone. And Joe, you had a question about whose decision it is, and I think it's a shared decision. I don't think you should ever feel like you're, as a consumer, that you're being pushed into one or the other. That if you don't feel comfortable and you say, look, I really want you on video because I need to show you something, then that's a discussion you should have with the practice or the GP or any other healthcare provider. Or if they want a video and you say, actually, I really want a phone call, and I have had patients say that, saying, I don't really feel comfortable on video. Can I please just stick to a phone? Then we respect that and we give you, the choice. But it's always a choice. And just going back to Ros's point, one other thing I forgot to say: when you do have a telehealth consult, if it's by video, always bring your phone with you, because if it cuts off, the first thing we'll do is we'll ring you on your phone. So make sure the phone is there and it's free and available, because otherwise we get nervous if it cuts off mid-sentence. We've just told you some bad news or something, negative has happened, and then we've lost connection with you. So please keep your phones nearby.
Yeah, and leading on from that, I think there's quite a few comments and questions. I mean, one's a comment about don't assume older people don't access visual. Older people, don't assume just because someone's older they don't know how to use FaceTime or Zoom or something like that. So always ask what people are comfortable with. But there's also a question about which platform and the privacy and confidentiality and the security of the platforms. Do any of you want to comment on that? Because I know that's a great concern for consumers from the questions and other things.
I might kick off the conversation. So yeah, as health professionals in Australia, we obviously have an obligation to keep confidential information safe, and that extends to our video platform that we select. I think that an analogy that I draw is, as a physio, we use specially designed tape to support joints. We wouldn't use sticky tape. As a podiatrist, you wouldn't use a butter knife to perform a toenail surgery. We need to use the right equipment. It's another tool in our toolkit, and we need to make sure that that is good quality. Our responsibility is to select a platform that is safe. And so by researching, I guess, the history of a platform in terms of breach and safety, that is part of our role to then make our selection moving forward. So I know that there are people reverting to what is easy and what has been used already, some of the social media video platforms, for example. But I personally think that we can do better, and I choose not to use those platforms because of the security risk that goes alongside with them. So it's important that it's easy to use, and I would argue that if people have the skill set to be able to use FaceTime or WhatsApp, they have the skill set to access a well-chosen but more secure video platform. They're not difficult to use. So yes, we have a responsibility, and we need to pick good quality tools for the job. Anybody else, Ros?
Yeah, listen, like I said at the beginning, the APS has done some research into the various platforms, because all of us health practitioners are bound by the privacy legislation, of course. So it's not an optional thing for us to do. And in particular for psychologists, confidentiality is such a big issue in terms of code of conduct, code of ethics, that we're particularly sensitive to all of this. And hence, over the last little while, we spent some considerable effort trying to work out the platforms that should guarantee end-to-end encryption and privacy so that clients don't have to worry at all. So with any luck, most of the people listening today should be able to trust that their practitioner has chosen an appropriate platform. But as Karen said, FaceTime, all those things are actually no good. Skype and even basic Zoom is not appropriate. What should happen though, it's not something you should worry about too much, because they should always be sending you a link. So whatever platform they've chosen, they're sending you a link. All you have to do is click on it and it should just work. It doesn't require any particular technical knowledge, regardless of age, can I say, around how to actually do it. If you can click on the link, the computer should do the rest for you. I just wanted to throw in one additional comment into the previous conversation, because I can see it in the Q&A a little bit if I can, Jo, which is, remember, you can still see your practitioners face to face. So when people are sitting there going, I'm being disadvantaged, you know, I've only got phone, my IT is not great. All of us have remained open to face-to-face consultations using appropriate social distancing, as well as sanitizers. We have temperature checks where I am, you know, all of that stuff. So I just wanted to not have people under the perception that they are limited to telehealth, although that's obviously what we're saying is a good idea today and better than nothing. They can do face-to-face still. So I just wanted to make that clear.
Yeah. Chris or Amanda, do you want to comment on the platforms, or in fact the point that Ros has made about people still being able to see their clinician face-to-face?
Look, I echo the security comments and ensuring that that confidentiality is taken into account when you're choosing as a practitioner the platform. I will say that you know, pharmacy has continued to stay open through COVID, and indeed a lot of people who have not realised their general practitioner has been available have come in and asked, look, what do I do? The social distancing, the hand sanitizer, a lot of that, particularly early on, and you may recall at the start of COVID, there was a lot of stock outages and a lot of worry that essential services might stop. And so we had quite an interesting journey into setting up that safety mechanisms. You know, people who frequent pharmacies are generally unwell themselves, and it's about keeping them as safe as possible, but still open and available for that.
Yeah, I just want to make a comment about still accessing your general practitioner in person, and all this talk of telehealth is really about enhancing access, and it's not about replacing face-to-face. So I think it's really important for people to not feel like they're being railroaded into only using telehealth. Our practice is open for patients to come in and see. The reason why we're doing telehealth first with a lot of patients is just to screen them and to make sure if they do have respiratory symptoms, or we're worried that they might be COVID patient, that we can be adequately prepared when we do bring them into the practice, and that we have our appropriate, you know, personal protective equipment available, and that we're not mixing them with other patients who are vulnerable. So it really allows us to do that planning, but there is never going to be a situation where primary care is 100% virtual. We think, I mean, and this is evidence that's based on international telehealth models as well, that 50 to 60% of things potentially could be done remotely, but there's still that 40 to 50% that absolutely has to be done in person. And I don't think we're ever, you know, going to rush straight away to that sort of breakdown. I think we're still going to be predominantly face-to-face, but we want to start giving patients choice, and we want to be able to start providing better care by giving them access when they wouldn't normally have access, and that's through telehealth.
And on that, I know Karen's service is an online-only physiotherapist. There's been some discussion about some people setting up purely online GP services and others. Do you have a view on whether that should continue? The pop-up.
Okay, yes. So look, there have been some companies that have set up as purely online, and I think you know, and Karen runs this from a physio perspective. I think from a GP, from a general practitioner's viewpoint, we always encourage people to have a main GP who looks after all of their care. And I think there are some circumstances where you might need to access a GP. You know, we've had people access after hours, you know, medical centres or home visiting services. And if your regular GP is not available, sometimes you can go and access these other services, and they will send information back to your GP, and your GP continues to be the main provider of your primary care. The same happens with a virtual sort of system, in that if your GP is available, then I would really suggest that you see your GP, and that can be seeing them face-to-face or seeing them virtually. I don't think just because you want to have telehealth that means you need to go to another provider. I think unless your GP isn't providing it. So the first instance, check that your GP is available. If they're not available, that's the point where you might want to look at these alternate services. But the alternate services must have some sort of process where they can send you for a physical examination if you need one. So it's always worth checking with them and say, look, if I do need to be examined, you know, what's the process here? Where do I go? Because we just don't want people ending up, you know, having multiple providers all online and nobody actually having all of the information about that patient in one place, because you're going to get records that are spread across all these different companies. So I think my message really is check with your regular GP first if they can see you face to face or via telehealth, and only if they're not available do you consider using an alternate service, and make sure they have an ability to link you into a face-to-face service if you need it.
Thanks. For all of you, what do you do with people who English isn't their first language? They come from a culturally and linguistically diverse background, or they may be deaf and and communicate through Auslan and things. What's the approach to, do you have access to interpreters, and are they easily accessible for you to use through video consults?
I would say that they're still accessible, and probably some of what we talked about before is true, that we perhaps, if they're at home, that we can use, it's not always appropriate, but we can use some family members or a friend who has a stronger grasp of English. Again, I noticed on the Q&A that somebody was saying they prefer Zoom because then they can still lip read if they have a hearing deficit. So I think at one level, the difficulties can be amplified, but equally they can be helped. So I would see that as still being akin to face-to-face in terms of an issue that we have to address client by client, depending on where the language or the hearing deficit might be.
Is there access to interpreters through telephone interpreter services, or something that can be part of a video telehealth consult?
Yes, I believe so.
Anybody else want to comment on that one? I know that came up yesterday. Karen?
I suppose I would just add that obviously the issues, concerns and opportunities raised through this phase will now be the impetus for new technologies to facilitate these things, for developers to see the opportunities, for, you know, there to be more streamlined ways to incorporate these things. So I think, yes, there are ways at the moment, but I do expect in the future these things will become much more streamlined and accessible because digital technology enables us to do that. So perhaps we'll even be in a place where it's more easy to access accessible platforms and, you know, things like interpreters in future, because technology will enable that.
Anybody else want to comment on that one? I think related to that was a question on the Q&A about using telehealth for multidisciplinary consultations, and I'm not sure whether that's covered under the current MBS items or anything, where you want to get your doctor and the physio and or the psychologist in a multidisciplinary case consultation. Is that possible using telehealth with the patient as well at the moment? Does anybody know?
I'm not aware that that's available. So government has been limited on what it's released. Others might know, but for example, we can't do group therapy. That's not covered under the current telehealth items, and reimbursed case consultation actually isn't covered under MBS generally at the moment. It's something that both GPs and psychologists have been pushing for, and physios may have been as well. So it's, my understanding is I don't think so.
Yeah, so I'm not sure from a funding perspective that they are funded for telehealth. We'd have to go away and check that. But it does raise a point about being able to do consultations with other people in the room, so to speak. And I have actually found that's a benefit. And it's more so I've had a parent and a child, like an adult child and their parent and myself, and we're all in different locations, and I've been able to bring them all in to be able to have a discussion together. And the child actually lived up in the Blue Mountains, the parent was in Sydney, and I was able to do a consult. And normally that child would have never been able to come to a consult in Sydney because of work and whatever. So it was actually an opportunity for the first time for the child to be involved in a medical consultation for their parent. So I think those, and again, talking about Karen, with what Karen had said, with digital technologies, we're actually opening up new opportunities to provide care in a different way. So I think definitely those group type discussions, be it with the patient or be it with other healthcare providers, is something that we'd like to see long-term sustainable sort of changes to support.
And I note from some of our people who are watching who also participated in a forum yesterday that yes, interpreter services are available. So it's always useful. It's a two-way exchange of information, these kind of things. People tell us things we don't know. The other thing that's come through some of the questions is around record keeping. And I think there's maybe a bit of a misunderstanding about what a telehealth consult is. People are saying, will it go on my health? Will it go onto my, will a record of this go onto my health record? Will it be in my patient case notes? Will you know, how will notes be taken? And also people have picked up on Chris's comment about recording and whether the clinician or the patient record the consult. Do any of you want to comment on that?
Oh, I'm happy to kick that one off because that's a vexed issue for some people. Listen, fundamentally the legislation and our needs to keep appropriate case records for 7 years or until a child is 25 is unchanged under telehealth. So if your practitioner would usually sit there and type some notes during the consult, they will probably continue to do that. If they usually type them up afterwards, they'll continue to do that. I think, as with all other things, if we record a session, it does become part of your client record. So most practitioners are very loath to do that, but definitely also need to seek your approval at the time if they're going to record that particular consult. And as was said much earlier, the difficulty for us is we don't actually want the sessions recorded by you as a consumer either. So making sure right from the get-go that we're, I know you may think it's easier because then you can get a double dip, you can go back and review it and, you know, be really clear on what exercises Karen said and all of that stuff. But because it does then form part of a medical record and is a legal document, we just don't want that done and don't want it used inappropriately is the main reason. Protecting your privacy as a consumer is absolutely a priority. If somebody else was to see that recording, put it on Facebook, do something inappropriate with it, that would be absolutely horrendous.
Anybody else want to comment on that?
Yeah, so I just want to make it clear that I have had patients who who've been seeing their GP, and I've done some consults from home, and there's been worry that I can't access their record. All of the GPs that do telehealth, regardless of their location, must have access to your clinical record. So it's pretty much like walking into your general practice where we use the same patient management system. We still have access to your pathology results, your radiology, which again makes it slightly different to some of these online providers who may not have access to your old clinical records. So it's good practice to try and stick to your GP if possible. And we type notes just the same way I would with you sitting in the room, and those notes are kept in that same file. And so there's just that continuity of medical record keeping. So it shouldn't be any different. And you certainly do not need to record it. And we don't need to record it because it would be like putting a camera in the consult room when I'm seeing you in my practice. I don't record that. So there's no reason to record a video consultation where we're doing the same thing, as long as we've got good written clinical notes, and that's what we make sure we have.
Does anybody else Karen, did you want to say something on this?
Yeah, look, I certainly agree with all that everyone has said in that our obligations are exactly the same in terms of keeping records. We also do need to look at the opportunity that digital presents, and with the client's permission, for example, in a musculoskeletal sense, if we were looking at progression of an ability to move a joint through a certain range, we may, with permission, take a screenshot of that range of movement, secure that image in the person's clinical record, and that allows us to, you know, have a really good record of progression over time, for example. So there are a few opportunities that you know, it can present that can allow us to keep sometimes better clinical records with the ability to do that. But of course, it's a patient can't legally record the consultation without our permission, and likewise, we can't record images or videos from the consultation without express permission, and obviously explaining the reason to do so.
That's really good, and thank you for all the questions. I'll just give each of the panelists 1 minute each to say, what do you think is, what do you hope happens next on telehealth? 1 minute. Karen.
So I think what we'll see post-COVID is that many bricks and mortar clinics that transitioned to telehealth for this time may revert back to bricks and mortar and happily do that forever. However, there will be a number of health professionals that see the opportunity, that see the demand, and can really streamline and improve their services to make it much more user-friendly for the consumers and for the therapists, and perhaps allow us to really niche and reach further with particular specialties than we have been able to have done before. So I think the landscape, of course, will be completely changed in a good way.
Ros?
I would agree with Karen that some people will well, it depends on government funding. I'll be clear that I think a lot of psychs would continue what I'd call a hybrid model, where we do some face-to-face, but we do some telehealth going forward, even once COVID is over. But that's going to depend on government funding, whether they're willing to continue this forward movement under digital transformation. So my final point would be the APS, the Australian Psych Society, has got a guide for consumers on the website on psychology.org.au. And as things change and progress, that's where we're noting for the public and consumers what's actually going on. So please have a look at that to stay in touch with our push to keep telehealth as a viable option.
Chris, what would you say?
Well, I'd continue on making telehealth available, particularly from a medicine safety perspective. Also to call out a point around case conferencing, the ability for one patient to see multiple providers at once. One of the issues that we see is the delay between getting from one provider to another, and that can help to solve it. In fact, we have pharmacists that do telehealth consults long before COVID, together with an exercise physiologist in the chronic pain space. Now, that is privately funded. Pharmacists aren't funded for case conferencing, unfortunately, but that continuation, to Karen's point, leveraging the benefits that this provides into the future shortly. In fact, yesterday was the first electronic prescription to be successfully sent. So whilst continuing on the medication reviews being run through telehealth, and the rapid uptake of electronic prescriptions, providing a much safer way to provide medications, and continuing delivery for anyone who can't physically make it to the pharmacy.
Amandeep.
Yeah, so look, I'd love to see the future of general practice be this hybrid model that Ros talks about, where we offer our patients both options and they can choose and the doctor can choose. I think it is very dependent on government funding. So I think if you, as a consumer, have really enjoyed and benefited from having access to telehealth during COVID, please let your general practitioner know so that they're encouraged to continue it post-COVID. And the more they continue it, the more likely we are to get funded. So it's really got to be driven by patients as well as by government and by doctors. And I think the other point, as Chris has just reminded me, is that I really hope that we get all of the other digital health infrastructure in place, and the electronic prescribing, the secure messaging, get rid of the fax machine. We'd like to get rid of paper. And so if we have that whole electronic system humming along, we're going to provide a really efficient, effective healthcare system for our patients. So that's the future that I hope we end up with.
And that's a great point to end on. Thank you all very much. Thank you to our panelists for giving us their time and answering questions. Thank you to everybody who joined the webinar. I hope you found it helpful. We have got a recording up. We will have a recording of it up if you missed it, or if you want to get in contact, then you can get in contact with CHF and we can forward the details of that on to you. So thank you all very much. Have a good afternoon.
Thank you.
Thank you, everyone. Stay safe.
Yeah, stay safe.